I'll invite Tracy Soltis to come up and tell us about the training of acupuncturists in the United States now.
Bring that down to me a little bit. Thank you, Dr. Miller. Welcome, everybody. I hope you enjoyed your acupuncture treatment that you've just received. Today, I'll be speaking to you to help you to better understand the acupunctural educational training and qualifications of our nation's acupuncture professionals. The term acupuncture in the U.S. is used both to describe the use of thin, sterile filaments, which you just experienced, to affect change in the body, but as well, this term is used to describe a comprehensive, dynamic, and elegant healthcare system that encompasses a variety of traditional and modern East Asian healthcare therapies. In this broader definition of acupuncture, we understand the term to encompass a wide range of traditional and modern medical practices that integrate different types of treatments, including acupuncture, herbal medicine, bodywork, and manual therapies, which diagnose, treat, and prevent an extensive variety of illnesses and ailments, about some of which Dr. Miller just spoke. The National Certification Commission of Acupuncture and Oriental Medicine says that acupuncture, as this comprehensive system, has, quote, arguably one of the highest levels of sophistication with respect to integrative medical concepts. This assertion is made primarily based upon the emphasis during an acupuncturist medical training that is placed upon traditional diagnosis in conjunction with the requirement for participation with other healthcare providers in the broader medical marketplace. So, in other words, an acupuncturist must be trained to understand both his or her own trade as well as how it relates to and translates into mainstream medical terminology and concepts. As a result, an acupuncturist training includes a robust amount of coursework specific to modern biomedical systems and concepts. As Dr. Miller noted, our most recent totals show that there are approximately 34,400 licensed, certified, or registered acupuncturists qualified to practice in the United States. The Accrediting Commission for Acupuncture and Oriental Medicine lists 56 independent institutions in 22 states, offering a total of 95 different accredited or candidacy status programs in the study of acupuncture and Oriental medicine. Enrollment in these programs over the last 9 years has remained between 7,000 and just over 8,000 students per year, with the schools having a capacity to accommodate even higher enrollment should the conventional medical institutions continue to increase gainful employment opportunities to providers in this important and unique healthcare field. One of the greatest barriers to actualizing the resources of this untapped workforce is the lack of understanding regarding the extensive training that acupuncturists undergo in order to qualify for licensure or their state equivalent. As scientific evidence continues to grow regarding the effectiveness of acupuncture, we're seeing a rise in the number of insurance companies that choose to include acupuncture as a health benefit, and more institutional settings such as hospitals, Veterans Affairs, even the Department of Defense are adding acupuncture as an optional treatment to both inpatient and outpatient care. But this availability is still in its infancy. Access to readily available, cost-effective acupuncture treatment is still the largest barrier for the patients that are in need of these services, and lack of sensible reimbursement mechanisms still stifle the growth of the field. Most health insurance plans continue with acupuncture limitations or exclusions from their health insurance packages, and there remains a lack of job opportunities for licensed acupuncturists in conventional medical institutions. We have a ready and ably trained workforce, but the patients can't access it because of these misunderstandings that perpetuate outdated restrictions, which then exclude services. While a growing handful of our allied health occupations may be permitted by individual state law to perform specific acupuncture protocols or shortened treatments under limited circumstances and with restrictions, the comprehensive field-specific training that a licensed acupuncturist receives renders them the experts on acupuncture and its practice in both historical and modern context. A licensed acupuncturist's extensive training and understanding of the full breadth and complexity of the system from which acupuncture emerged allows him or her to tailor protocols and individualize treatment to that which is going to best serve each patient's unique healthcare needs. Rather than diverting our existing medical professionals who are already providing valuable and much-needed healthcare services from their intended work, healthcare institutions could immediately be encouraged to bring on licensed acupuncturists who can work with the patient's physicians as a supportive member of the comprehensive care team. 47 of our nation's states, as well as the District of Columbia, formally regulate the practice of acupuncture by requiring the provider to become licensed, registered, or certified. The 3 remaining unregulated states, Alabama, Oklahoma, and South Dakota, have begun the process of codifying formal regulations into law, so we expect to see this number include all states in the coming years. The process to become a licensed acupuncturist begins with graduation from an accredited master's degree or certificate level program. The Accreditation Commission for Acupuncture and Oriental Medicine, or ACOM, is the national accrediting agency that's recognized by the U.S. Department of Education to accredit both master's and doctoral level programs in the field of acupuncture and East Asian medicine. There are 2 tracks for master's level degree programs. The minimum standards for these 2 entry-level programs can be seen here in the charts. We have the Master of Oriental Medicine, that's the MOM degree. It's a minimum 4-year, 2,625-hour program consisting of 705 hours of foundational Oriental medicine and acupuncture-specific theory. This includes East Asian medical theory, diagnosis, and treatment techniques in acupuncture. 450 hours of didactic herbal medicine studies, 510 hours of biomedicine-specific training, another 90 hours of counseling, communication, ethics, and practice management, and then at least 870 hours of acupuncture and herbal supervised clinical training. Some traditions of acupuncture do not include herbal medicine component, so you'll see here that our licensees may also complete a Master of Acupuncture degree with the same requirements in acupuncture theory, biomedicine, etc., but with 660 hours of supervised clinical training, however, without the added hours specific to herbal medicine. While these are the minimum educational standards required by ACOM, in actuality, many of our schools offering acupuncture training programs have a far more extensive program, offering between 2,200 and 2,400 hours for the Master of Acupuncture and 3,000 to 3,100 hours for the Master of Oriental Medicine program. In addition to the entry-level master degrees, the profession offers 2 distinct doctoral degrees. The postgraduate clinical doctorate was developed with a curriculum focused on specialization and advanced knowledge and skills. This ACOM-approved postgraduate degree is known as the Doctorate in Acupuncture and Oriental Medicine, DAOM, and it consists of a minimum 1,200 hours, 650 of which must be dedicated to advanced clinical training. Candidates of the DAOM must have completed the master degree program to be eligible for admission to the DAOM program, so these 1,200 hours are in addition to the 2,000 or more hours they've already completed in their master's degree. The second path to doctoral degree completion is the entry-level professional doctorate. ACOM has approved standards for an entry-level professional doctorate in acupuncture and a doctorate in Oriental medicine. So these 2 entry-level professional doctorates add an additional 300 hours of training onto the minimum requirements for the master's program, with a minimum of 790 hours of clinical training for the Doctorate of Acupuncture and 1,000 hours of clinical training for the Doctorate of Oriental Medicine. The professional doctorate coursework expands upon subjects such as patient care and advanced diagnosis, systems-based medicine and collaborative care systems, professional development, and an increased incorporation of scholarship and research focused on evidence-based medicine. These additional requirements prepare the graduate to integrate their skills into the conventional medical institutions and to be a fully supportive, collaborative member of the patient's current team of medical providers. Following this extensive educational and training process, acupuncturists then sit for their national certification. The National Certification Commission for Acupuncture and Oriental Medicine, NCCAOM, is the national organization that validates entry-level competence in the practice of acupuncture through professional certification. Its mission is to assure the safety and well-being of the public and to advance the professional practice of acupuncture and oriental medicine by establishing and promoting national evidence-based standards of competence and credentialing. After an acupuncturist has completed their formal schooling via an accredited program or an approved apprenticeship, he or she may obtain national certification with NCCAOM by sitting for and passing 3 to 4 certification examinations, including acupuncture with point location, foundations of Oriental medicine, biomedicine, and Chinese herbology, as well as showing documentation of certain safety-related specific coursework such as clean needle technique or CPR. Acupuncturists who complete the NCCAOM certification process are referred to as diplomates of acupuncture or diplomates of Oriental medicine, depending on the certification path for which they have applied. NCCAOM certification serves as documentation of competency for licensure in 46 states and the District of Columbia. Currently, California is the only state that administers its own licensure examination, but in 2016, the California Acupuncture Board voted to require the NCCAOM exams as one of the prerequisites for licensure, and they will adopt these exams beginning as early as 2019. Certification is also required by many employers, insurance companies, and hospitals. It's considered a very prestigious professional achievement to earn the designation of diplomate from NCCAOM, as it indicates to employers, patients, and peers that one has met national standards for the safe and competent practice of acupuncture. NCCAOM reports that there are currently 17,600 active diplomates practicing worldwide, and in the last 35 years, the organization has certified 29,839 individuals. NCCAOM is a member of the Institute for Credentialing Excellence, and its certification programs are accredited by the National Commission for Certifying Agencies, that's NCCA, whose standards exceed the requirements set forth by the American Psychological Association and the United States Employment Opportunity Commission. In order for NCCAOM certification programs in acupuncture, Chinese herbology, and Oriental medicine to remain accredited by NCCA, the NCCAOM must adhere to strict national accreditation standards for administration of the certification program and examination development. All diplomate level certification exams must meet content validity standards that are set forth by NCCA. So to ensure that the certification exams are valid, NCCAOM conducts a job task analysis survey of the practitioners in the profession every 5 years, and revisions of examination questions are based upon the survey's results. This assures that the content of the exams accurately reflects advancements that are always happening in the profession, and that certification candidates are able to competently perform the tasks that the acupuncture practitioners that are already licensed are doing on the job. So this gives you a snapshot of the high level of education, training, and testing standards for acupuncture in the United States. This concludes our formal presentation, and the panel will now like to open the floor for a brief question and answer session before Dr. Miller gives us closing remarks. Is there anybody out here in the audience that has questions for us?
David, when you were talking about the cost effectiveness, you mentioned, I think, Massachusetts, and you mentioned about 76 cents in additional cost. Was that the cost in terms of the
I believe that
plan?
the premium cost, yeah, was going up. Right. People are worried that it'll skyrocket their health insurance costs and things like that too. And that study done within Massachusetts officially to look at what it would actually cost revealed those numbers.
I mean, is there research that shows when acupuncture is used instead of additional traditional, what the cost saving is comparatively?
So there's the question is there data to look at the cost savings really that's the cost effectiveness, I suppose, of the acupuncture, looking at it when compared to conventional care, I think, if I understood the correct. And there is for certain conditions. And so in that same report, there was the mention of savings of $30,000 for a number of conditions, $9,000 for another, $4,000 for another. When you look at those specific conditions, the estimated cost savings would be in those ranges. Yeah, thank you. Good. All right. Step back up here. Well, I want to thank you all for coming. I want to thank our acupuncturists who gave treatments, those of you who got treatments, our panelists. Yes.
There will be one more session.
Oh, there will be one more session. Okay. Oh, fantastic. Okay, good. So you'll get to enjoy that. And I hope we've given you a little taste today, a little, painting of what's available to us. We have a huge problem. We have a solution at hand. We have a workforce available. We have some systems-based things we need to tweak, to fix, but that could all be done very quickly. And we could really make a dent in the opioid epidemic and treating it in a more holistic way and make the whole society healthier and less dependent. And we could save money while doing it. So thank you all for coming. Really appreciate it.
Thank you.